Nice for 2 minutes.
I rise to pay tribute to Clarence Lupkin. This is a great day for the state of Ohio. The mayor of Linden deserves to have a post office named for him for all his service. I do hate to pollute this debate with facts. I'm really almost hesitant to do so. The previous speaker pointed out an inequity that exists, that frankly Medicaid doctors don't get reimbursed enough. And we're fixing that in a reconciliation bill, so I trust my colleague will be voting for that, because it increases the reimbursement rates for people that we're expanding coverage to, so the doctors will pay at the Medicare rate. You know what you won't hear today in this conversation about this post office is that Mr. Lupkin, who we're honoring today, I think he's about 70 years old. Certainly. I mean, we don't have a lot, so
I understand. I appreciate it.
Go ahead.
We said that we're going to give a raise for primary care physicians.
Yeah.
That is actually not included in this in terms of the Medicaid costs. So state Medicaid costs are now going to go up.
Yeah. Reclaiming my time to inform the gentleman that he's wrong. So the gentleman from Ohio, Mr. Lupkin, no, after yielding that, it really wasn't.
That's okay. We'll get back to the facts.
Wasn't much of a payoff. So I'm not going to yield this time.
It will be.
Mr. Lupkin, who we're honoring
today. The House will be in order.
Mr. Lupkin, who we're honoring today, if it were up to the members of the minority party, that Mr. Lupkin would not have Medicare, would he? He would have had Social Security privatized. Now, I couldn't help noticing that not long ago, the ranking minority member of the House Budget Committee, a Republican, floated a plan that for once at least was honest about the intentions of the Republicans. It said Medicare, end it as a program we know, and I know that the previous speaker doesn't like it. A lot of my constituents believe it's a very worthy program. 96% of all beneficiaries who were surveyed last year said they like it. But the Republicans say, no, we want to eliminate it. And let's not forget how many of them signed on the dotted line to privatize Social Security. Boy, that seems smart, huh? Investing Social Security in the stock market. Now that's a far-reaching ideal. Now, Mr. Lupkin, who God willing will live another 20, 25 more years, he's going to be able to see Medicare for the rest of his life, thanks to the bill we're going to pass in short order. And thanks to the votes of the people on the other side who would deny them that. Now, you might not like Medicare, but come out and say it. Don't say, we were going to propose privatizing it. Let's see what you can do. Can you get a majority over there to stand up, to come out from behind the artifice, and to say, forgive me, with the speaker...
Gentleman's time's expired.
I'll yield him another 25 seconds.
Look, the fact of the matter is there's a difference of opinion here, and they're philosophical and deep felt. We believe in Medicare. We created it. You opposed it at the time. You oppose it now. We support Social Security. I would direct my remarks to the speaker. Can you inform them that they oppose Social Security then? They oppose it now. This is a philosophical divide. And every single member of the minority party has said that they're going to do anything they can to stand up in defense of the health insurance industry. That's a consistent position. We disagree with it. And Mr. Lumpkin's going to have Medicare for the rest of his life, which should be long and
Gentleman's time expired. Gentlewoman reserves the balance of her time. Gentleman's recognized for 4 minutes.
It is my pleasure to stand up in support of this resolution in support of Women's History Month. It is important to note that here in 2010, that insurance companies very often, health insurance companies very often, charge women exponentially more money to get health insurance than they do for men. Now, why they do that? Because health insurance companies have been empowered by the present system, not because they're venal or bad, but because it's their job, is their business model, to take in as much money as they can and to give as little service as they can. That's their business model. It's their business model to try not to provide any insurance at all for the toughest to insure, so they drop people who have any pre-existing conditions or who start to rack up needs, meaning people who get sick. They don't cover anyone who's over 65 because we, the federal government, decided 44 years ago, over the objections of many of my Republican friends, to create the Medicare system. But let's talk for a moment about this notion of jobs. Jobs for women, jobs for men, jobs for the next generation. The idea that we can continue this way, putting 20% of every single dollar we produce in this country into health care, is why, my friends, our wages have been stagnant for the last 8 years. Because when an employer gets any additional money, it's got to go into keeping up with the high cost of health care. And you don't have to look in a book. You can go look in Michigan. Take a look at the difference with the exact same union contract to build a Chevy Impala on the Michigan side of the Canadian border or on the Canadian side of the Michigan border, the same exact automobile. General Motors did what any sound-minded company might do. They said, wait a minute, I'm paying an extra $7.25 per hour per worker on the New York side of the border, on the Michigan side of the Canadian border. I'm going to stop doing that and move them overseas. We simply are less competitive with the status quo. In every instance except one, the health insurance industry. They're doing well. They're doing remarkably well. And you know what? I am at the place, I think a previous speaker said, I would have preferred to say, you know what, let's take the Medicare system, people understand it, let's extend it to people 55, let's get younger people on, let's try to do this right. Let's take an organization that has an overhead rate of 1.05%, 1.05%, 25%. That's what I would have done. That's what I would have done. Now, my Republican friends have their own proposal. And let me tell you exactly what it is. It says anyone over the age of 55, who's not 55 today, will not have Medicare the way it's structured today. They will essentially get some type of a voucher and say, good luck. You will not have Social Security under the Republican plan because they would invest it in the stock market. Yeah. No, it's not a joke. This is their proposal, not from 10 years ago. This is the ranking minority member. And they don't talk about it much, God bless them. They don't talk about it, but that's their proposal. You know, there's an expression down south, and I'm not very far south in Brooklyn, but that says, you know, it takes a great man or a great woman to build a barn, but any jackass can kick it down. And what that expression means is, yeah, writing bills is complicated. To say it was rushed, I got to tell you, a year plus 2 years talking about it in campaign, plus 30 years festering is a problem. And now I heard one of my colleagues say, wait till Thursday. What do you got a Final Fours you're watching or what? I mean, honestly, wait till Thursday. 20% of the economy, I'm busy. Wait till Thursday. You know, I don't want to, I want to see if Sienna makes 2 rounds. Let's wait till Thursday. Sayonara. All right, look, that's, the minority party had an opportunity for 8 years, and the trend went like this. For health insurance costs, went like this for incomes. That's what happened. We're not going to let it happen anymore. So there was a decision made that had to be made. Are you going to try to solve the problem, or are you going to stand up for the insurance industry? On this side, we chose to try to solve the problem. It ain't perfect, but it sure beats what we're hearing over there.
Gentleman yields. Gentlewoman from California.
Mr. Speaker, I yield 1 minute to the gentleman from New York.
Gentleman's recognized for 1 minute.
I would ask the American people to listen to the following exchange. Will the gentleman from New Jersey kindly inform the House the source of the memo that he just read from? That silence that you hear is the gentleman from New Jersey read from a fake memo, a fraudulent memo. He's been Zoomed. It wouldn't be the first time, but that is the case. That memo that he just read from has no source. He will not return to the microphone and tell us what it was because he took something that was created by opponents of health care, and there are a lot of them, mostly paid for by the health insurance industry, and came to the rostrum with a fake document.
Mr. Speaker,
Gentleman will suspend for what purpose is the gentleman right?
Parliamentary inquiry.
I don't yield for that purpose. I don't yield for that purpose.
I'm not asking you to yield.
No, that's not
the House will be in order.
Parliamentary inquiry, Mr. Speaker.
The House will be in order. The gentleman from New York controls the time.
And the fact of the matter is there's an enormous amount of money being socked in by the health insurance industry doing everything. They're creating ads. They're making contributions. But what they're also doing is producing fake memos that say, from the Democrats, with something crossed out on top. But the fact remains here that there is no reluctance to talk about the real CBO score. $1.2 trillion of savings for the American people. That's the fact. That's nothing we're hiding from.
Gentleman yield?
I will yield, if only for the purpose of telling us the source of the document.
Well, the gentleman not yield on the facts, then.
I will. I've asked the gentleman a direct question.
I'm responding with a direct answer. As much as the gentleman from New York.
Will be in order.
Sure.
Ladies and gentlemen.
Gentleman's time has expired.
Can I have 30 additional seconds?
I yield another 30 seconds.
Ladies and gentlemen, what you saw just now is a microcosm for this debate. A real piece of legislation that for a year we've been working on, and a fake document they won't even give the source for. We're going past that. We're not going to wait till Thursday to do it either, I say to my colleagues, or Wednesday. We'll do it when the bill is ready to be passed. Because we've debated this thing for a long time. We're here to solve the problems of the American people, not, quote, from fake memos.